Good morning, everybody, and
listening.
thank you to the nearly 59,000 people that came forward for testing in the last 24 hours to 8 p.m. That is a great result and something we obviously want to see continue, because the more testing we have, the more confidence our health experts have that they're capturing all of the cases in the community that may have been bubbling along for some days. I also want to report that to 8 p.m. last night, New South Wales recorded 18 cases of community transmission. Of those 18 cases, all but one has been confirmed as a link, and the 18th case is actually in the vicinity of those other cases, and yet that link is yet to be established given some of these cases are fairly recent. I also want to stress that of those 18 cases, about a third of them, about 6 of them, were in isolation for the entire time. A number of them were in isolation for part of the time, but some unfortunately were active in the community. And as Dr. Kerry Chant has told us already, the cases we're seeing today are a reflection of what may have occurred in the previous week, and obviously there's a lag time by the time that we are able to record these cases. Now, whilst the numbers today are less than the numbers yesterday, we have to be prepared for the numbers to bounce around, and we also have to be prepared for the numbers to go up considerably, because as experience shows with this strain, we are seeing almost 100% of transmission within households, and we're seeing a very high rate of transmissibility. So it's really important for everybody to follow the health rules, to look for those venues of concern, to make sure you get tested and isolate if you've been asked to do so. Make sure you get tested and isolate for 14 days if you're deemed to be a close contact. That is really, really important. And I also want to stress to everybody how deeply grateful we all are. The way the public has responded in a very short period of time is very, very encouraging. It gives me heart that by working together we will get through this. And please know that I appreciate during these difficult times, everybody has an opinion. There are a lot of experts out there giving their opinion on what may or may not be the case. Please know that what has served New South Wales very well is that we've relied on the health expert advice of Dr. Chant and her team, and that is a source of truth we want everyone to really take advice from. So please know that the information we provide to you directly through these press conferences every day, through Service New South Wales or the newsouthwales.gov.au website or the New South Wales Health website, are all the sources of truth we'd like the public to rely on. It's really important for all of us to stick together and do the right thing. But I also do want to thank the community for the great job all of you have been doing, all of us have been doing in keeping each other safe. Today I'm pleased to say we have Commissioner Fuller with us, and I want to thank the entire New South Wales Police Force for their efforts during the entire pandemic, whether it's in managing the quarantine system or supporting us with compliance, and especially now when we have asked people not to leave home unless absolutely necessary. Police responsibilities have increased, and Commissioner Fuller, I've asked Commissioner Fuller to thank each and every member of the police force during this time, and Commissioner Fuller will be reporting on compliance activity and some of the examples that he's received about compliance or otherwise in the last few days. Today, Minister Hazzard will comment on the importance of vaccinations. It's really important for people not to miss your vaccination appointment. Pleasingly, in the last week, New South Wales broke their previous record, and we've done more than 105,000 vaccinations in a week, which is fantastic, and that's on top of the GP network who's already working really hard to get those vaccines out the door. So after I finish my few words, Dr. Chant will give an update on cases, Commissioner Fuller will give an update on compliance, and Minister Hazzard will stress the importance of getting vaccinated. But in the meantime, can we encourage people, if you are ordering in food, please try and order in contactless. Whilst you're allowed to go out and get essential services, essential food items, we're really keen to not have people move around. That's the effect of the lockdown. It helps when people don't move around, so please don't go around picking up things or delivering things unless you absolutely have to. We would prefer that people who are ordering in get that contactless opportunities, because for the lockdown to have effect and for us to manage the situation in the desired time frame we've set ourselves, it's really important for us to limit our movements and activity unless we absolutely have no other option. But having said that, Dr. Chant has been encouraging, and we all encourage people to go outdoors and get that healthy exercise. You can do that in up to groups of 10. You don't need to wear a mask when you're exercising, but you do need to make sure you're maintaining good social distance. And the most important message I'd like to give everybody is every time we leave the home, we have to assume that ourselves or other people around us have the virus. That's the way we have to live during the lockdown and beyond. We just have to assume that we have the virus or that others around us have, and we have to act accordingly. So again, thank you to everybody for your vigilance. Thank you to the outstanding contact tracers who are at this stage staying ahead of the game. The way in which the time frames between identifying cases and then closing down the close contacts has just been the best I've seen since the pandemic started. Can I say that I've had the opportunity to live with this every day, and I've had the opportunity to live with this every day, and the way I've observed our contact tracers work in the last couple of days has just been the best I've seen. It's been outstanding. The rest is up to us to follow the health advice, to limit movement, and to really ensure we don't spread the virus unintentionally. And now I'll ask Dr. Chant to give her update.
Thank you, Premier. So there were 18 locally acquired cases of COVID to the 24 hours to 8 p.m. last night. 15 of the new cases are linked to the Bondi cluster, and we've had 3 cases that have acquired overseas. There are currently the key highlights for today in terms of the key messages that I would like to get across firstly are that we are asking people, we do want to at this time protect our elderly. So it's important that we don't have visitors to hospitals and visitors to aged care facilities. Those steps were taken very early on. We routinely engage with the aged care sector and provide advice, but I do want understanding at this time. There are obviously exceptions to those where there may be end-of-life care or critical moments that it is important that you visit, but we would ask you at this time to minimise your attendance of those and only do so for those very special and extreme circumstances. I'd also like to say that older people are prioritised in the queues for testing. We have seen a few cases of elderly people that have been infectious in the community, and it's led us to wonder whether they're concerned about waiting in queues or the time it may take. I just want to reassure those elderly members or the frail members in the community, as well as pregnant women, that should you present, we're asking all our services to have a sort of prioritised queue or a way of bringing you to the front of it so that you don't have to wait. We would ask you to reach out to your general practitioner by the phone, and he or she could give you advice about what's the best testing option for you. But we do really want to make sure that we are testing everyone, and particularly those people with symptoms in Dover Heights, Vaucluse and Bellevue Hill. Just to reassure you, there's many testing sites in those areas, and please come out for testing. I think it's also important that we note that getting vaccination is a key thing. We're also seeing some of our elderly cases not vaccinated, and I just want to remind the community that whilst initially there were really constrained supplies of our AstraZeneca vaccine, the Commonwealth has rolled out that vaccine progressively through general practice, and we also have access through health clinics, and I would urge everyone to take this opportunity. Now, if you are going to get a vaccine, a couple of safety tips. Please do not go if you have any symptoms, and please, before you set out, please check the exposure venues to make sure you don't feel you aren't a close or casual contact, and follow that public health advice. Please wear a mask, and but please go out and get vaccinated, and we urge you to do so. There's also been quite a lot of confusion between the stay-at-home requirements and the self-isolation requirements. and our close contact tracing teams had a number of people calling up. So just for clarity, if you are a close contact, you are required to isolate. And isolate means that you do not come into contact with anyone else in your house. It means that where possible, you've got a separate bathroom, you wear a mask if you're transiting through any shared areas. In effect, you are in a cocooned environment away from others. It is critical that you do so. The stay-at-home measures mean that you are only permitted to leave for the 4 essential reasons or with a reasonable excuse. And as we've indicated, the order specifies examples of those, but we really are asking for common sense. At this time, we do not want people spending large amounts of time in retail environments, other environments. We want you to minimise your contact with others. I know for many people that are subject to the stay-at-home requirements, that it is a time where they would appreciate phone calls from friends and relatives and keeping engaged with them. Now, if people are also providing care and support to those individuals and, for instance, dropping off meals, if that could be done in a contactless way, but if you do need to support your aged and frail relative and you do need to visit, please wear a mask even indoors and try and visit at the more warmer parts of the day, and if it is a sunny winter's day, sit out and use well-ventilated spaces. Again, but do not visit anyone if you have any symptoms at all. In terms of some of the cases that we just wanted to mention, is there were 2 additional South Coogee Public School students that tested positive for COVID, bringing the total number of students with COVID at the South Coogee Public School to 4. And because of those additional cases, and because there's also a number of interactions between the school groups in the different year groups, all students are now close contacts and must get tested and self-isolate for 14 days regardless of a negative test. There was also a child at the Emmanuel School that was present whilst infectious, and information is going out to that school community defining who is a close and casual contact. That communication is going out through the school consistent with the advice of the Public Health Unit. It is important, we've also had some questions in relation to when a child becomes COVID positive and what steps you need to take. And basically there is a plan developed, and a bit depends on the age and independence of the child, but it's very much a tailored one. The considerations are, if you are all exposed at the same time, what works for you as a family, what are the health conditions of the people that may be in that household, what is your ability to self-isolate, and obviously the age and independence of the child. So all of those factors go into how we do a self-isolation plan. So my key messages: get vaccinated, support your loved ones, encourage testing, and please follow the health guidelines. And please, this is not a time to think, oh, the health guideline says this means I can do something a little bit outside the box, or this is a time for us to pull together and comply. We are going to see the numbers bounce around. So I am pleased to be announcing 18 today, but they will bounce around. As I'd indicated, what's going to be key is the number. We would like to increasingly see all our cases are occurring in isolation. All the cases are linked, and we will need at least another 5 days to see this picture turn around. The restrictions came in towards the end of last week. There were other mitigations earlier on, but the cases we have now reflect exposures that occurred 5 days ago. And therefore, it is important the community understands that the numbers are not expected to decline for another 5 days. But if we don't want to see these cases dribble on, we all have a role to play in adhering to the health advice. So if you are a close contact, don't think I'm vaccinated or I was really only there for a few minutes. please follow the health advice, stay in there for the 14 days, get the tests and follow the health advice. That will give us the greatest chance to see this, achieve no community transmission as quickly as we can.
Good morning. Thanks, Premier. I can just say that the police operation over the course of the last 24 hours continues to ramp up statewide. We issued some 44 tickets to individuals, most of those for people to failing of wearing a mask. But we also saw some evidence in relation to people out of their homes or out of the greater Sydney area without reasonable excuse. A 33-year-old man from Ermington was stopped at Goulburn without reasonable excuse, was issued a $1,000 fine and returned home. Unbelievably, we saw 2 men sunbaking naked on a beach on the south coast. They were startled by a deer, ran into the National Park and got lost. Not only did they require assistance from SES and police to rescue them, they also both received a ticket for $1,000. Now, it's only a small percentage of the New South Wales people that are not following the health guidelines, but I can assure you, if you breach the health orders or the guidelines, you will be punished. Can I just say, from a law and order perspective, police continue to patrol and we are out in the same numbers protecting the people of New South Wales. Crime continues to fall in most categories. You are safe at home and you are safe if you do have to travel for those essential reasons. Thank you.
Thank you, Commissioner. We have had a number of inquiries from individuals asking whether or not leaving home for a vaccination is an essential reason. Can I just stress that of the 4 reasons, if you have to leave for health reasons or vaccination reasons, there probably is nothing more important. Vaccination, if you have a vaccination appointment, go and get the vaccination. To emphasise just how important vaccinations are, I remind the community that we had a party that was reported at West Hoxton early in this outbreak. I can report that of the more than 30 people that were at that party, 24 of those people are now positive for COVID-19. And not one of those 24 people were vaccinated. I can also advise that 6 health workers who attended at that party who were fully vaccinated, not one of those people has been infected with the COVID-19 virus. I can also report that there was one aged care worker at the party who had had the first dose, and that aged care worker was also not infected at the party. Now, obviously, it's an unfolding situation, as is every aspect of this COVID-19 pandemic, but the early and strong indications from that party, that West Hoxton party, are if you're vaccinated, you're almost, you are much more likely to not be infected with COVID-19. So for those who still out there think that vaccinations aren't important, they can find excuses not to have vaccinations, they can kid themselves not to have vaccinations, they can listen to the other experts who like to get onto social media and say don't get vaccinated. Short message is get vaccinated.
Dr. Chant, I'd like to ask you about the transmissibility rate of the Delta variant that we're seeing now, how it compares to what we originally saw, and are you concerned about the transmissibility rate amongst children that clearly wasn't there earlier in the pandemic?
We've always known that... apologies. We've always known that COVID can transmit between adults and children, but the previous variants, our experience was that that was much more remote, particularly children infecting other children. What we know is that the Delta variant is associated with increased transmissibility across age groups, and I think that the Delta variant will give us cause to even redouble our, strengthen our guidelines in relation to schools, and our approach to schools will need to take into account the fact that it is increased transmissibility. So we'll have a much lower threshold for calling people close contacts in the school setting. And I think we're still learning a lot, and we're learning from the international experience about that. But I agree, it certainly is a concern, the increased transmissibility and the observation around children.
The Sunderland case reported today, Dr. Chant, you said investigations are ongoing, a possible Westfield Bondi Junction exposure. Does that possible exposure date back to what was 12th of June to the 19th of June? Is that when you think this unlinked case may have got the virus?
Look, at the moment, what we're saying is the case lives in the areas and the LGAs that we've known have been associated with transmission. I think a large number of people frequent a large number of shops, including Bondi Junction. I'll have to get the exact dates that they transmit there, that they attended there. But clearly the key point is we're not calling it linked until we actually find a crossover point or pursuing a number of lines of inquiry. And I think it's really important that we do that, because what we're trying to do is see what confidence we have that all the cases have been thoroughly linked and that we're not missing those unrecognised chains of transmission.
Okay.
As I said, it's been evident that there have been some lanes of transmission that have occurred and that have been unrecognised, and what we're seeing now is the consequences of that in the number. And that's why we've got to redouble our efforts, and the lockdown, and hence the reason for the lockdown of Greater Sydney. Any cases that are occurring now, even if they are positive, there certainly is a risk to their household, but hopefully if they've followed the stay-at-home orders, even if they've gone out to the shops, they're wearing masks. The staff in the retail premises will be wearing masks. We will have minimum exposure venues, and that will allow us to stop the community transmission.
Dr. Chant, to give us an example of the size of the spread, can you tell us how many exposure sites we're looking at and the number of close contacts you're currently monitoring?
There are thousands and thousands of close contacts. I suppose I also want to take the opportunity to really call out the venues where we know transmission occurred. So it's important that we often have venues, and some of them, just for transparency, are very low risk venues, but for transparency we put them on the website. What we are more concerned about is looking at those venues where the cases have either transmitted to their family or transmitted to people at the venues. So just as a bit of a summary for the community, the sort of venues that we're particularly wanting to make sure we have identified everyone who is possibly at the venue. And this is the Life Cafe Bondi Beach from Wednesday the 16th of June from 12:30 to 2:15 p.m. From Friday the 18th of June to Saturday the 19th of June, and from Tuesday the 22nd of June to Thursday the 24th of June. In terms of the Joe Bailey, we continue to see cases arising from that. From Tuesday the 15th of June to Wednesday the 23rd of June. Great Ocean Foods, we are still seeing some cases amongst staff, and obviously have put out a request for any deliveries, that people that may have received deliveries from that Great Ocean Foods, from Monday the 21st of June to Friday the 25th of June, and the Royal Bondi at 283 Bondi Road, 7:50 to 9:30, Saturday the 19th of June from 5 p.m. to 6:30. So we have a large number of venues. Not all of them have been transmitted. We do need about 5 or 6 days to give us that sense, because it takes a little while for the testing to come in. And that's the sort of information that we evaluate every day. So when we sit down, we look not only at the cases reported, but how many tests have come back negative in those settings. What is the comprehensiveness of the QR codes? Does that mean that we've got everyone? Were we able to identify accurately who was there? These are all factors that give us either reassurance, or concern that we may be missing cases.
Can you explain, Dr. Chant, can you explain what happened with the Crossroads Hotel and the Crossways Hotel? The Crossroads initially
Yeah. Look, my apologies. This was really a miscommunication, and I'm in the process of writing to the Crossroads Hotel. I think everyone breathed a sigh of relief, and I'm sure they did. It was really around a communication issue where the wrong Crossroads was attributed. Given the speed with which we're trying to get out to venues, I sincerely apologise to the Crossroads Hotel at Casilla. And certainly we've corrected that as soon as we found out about that error.
Is it concerning, though, that the people at the Crossways Hotel weren't told that they were potentially close contact?
Well, as soon as we identified that error, we immediately contacted people. I think that given the community would understand we are doing our best to get those venues up. I apologise for that error, but we then immediately contacted the Crossways patrons and also put that up on the website and issued a correction.
May I ask you, this particular variant, how many are you seeing them infect? So one person infects how many people, and how does that compare to what we've previously seen?
So in the past, for some of the early strains, we would see perhaps a household attack rate around 30%. And as I said to the ministers indicated, we're seeing upward of almost 100% in the households. Now, not everyone transmits, and that's one of the challenges with this virus. Not everyone is a super spreader or a transmitter. And that's why we also have to assess each venue, each locations, and whether a person has transmitted to their household contacts, whether they've transmitted at the venue, to give us assessment about the broad risk in those areas. I would also like to take this time to call out for the southwestern Sydney and western Sydney communities. We have had some sites, exposure sites in those communities, and I want to thank the communities for coming forward for testing. But we also want to be doubly sure we are not missing transmission chains in that area. And so I really do want to see the community respond with high testing rates there. They have responded, but they need to keep responding, because part of our assessment that we have not missed cases is this high testing rate. We have had magnificent testing rates, and I would like the community to keep coming out in those high numbers. We've had testing rates hitting the 50s for many consecutive days, and that is what we need for the coming week. Again, every single test you are contributing to the response, because if we can find a case, we can then move people from stay at home to absolute isolation, and therefore they definitely pose no risk to the community. But it is a lesson to be mindful when you're moving about. You can help us by moving about in a safe way, wearing a mask, and even outdoors if you're going into a crowded place or you feel that there might be a crush, wear a mask. Please do not go out if you've got any symptoms, however mild. Please keep monitoring both your mobile phone for text messages, but also the New South Wales Health website. But also, could you please QR check in? I mean, one of the issues that we have encountered is that some patron lists are not complete, and so we know that there would have been more people expected at premises than aligning with the QR codes. We cannot afford any gaps in the coming week if we're going to achieve no community transmission in terms of the time frame we have set.
Premier, just quickly, I think all three of you now this morning have spoken about vaccine hesitancy or people not coming forward.
There's no hesitancy. People want to get the vaccine.
So is there no hesitancy? Particularly any of the Pfizer vaccines that have to be used within a couple of hours of being extracted from the vial, any of them going to waste?
No, my understanding is that all the doses we have are being expended very quickly, and I want to thank everybody for coming forward in the last few days and getting the vaccine. We need that to continue. None of us have a crystal ball. None of us know what the future holds for COVID. But what we do know is that the vaccine is effective in preventing people acquiring serious illness. And from the cases we've seen to date, the vaccine is holding up very well, even against this variant. So whilst it doesn't mean you won't get it or won't pass it on, it is preventing serious illness, and whilst it's early days, we can see evidence of the vaccine holding up extremely well, either vaccine, and that's why we really want to encourage people to come forward and get it. If you've had your first dose of AstraZeneca, please come forward and get your second dose. It doesn't matter how old you are. If you're over 60, please go to your GP to get the AstraZeneca, and if you don't or can't, please call one of our health clinics through New South Wales Health.
What about AstraZeneca? Because there's GPs have raised concerns that it's going to waste because now it's such a limited age group that can get it. Is there any thought to try and rethink and get more people vaccinated?
Well, look, obviously, as I say, the New South Wales government can't control the supplies we get or the doses we get, but what we can control is providing the health advice and making sure that everybody eligible feels confident to come forward and get the vaccine. If you're over 60, please contact your GP to get the AstraZeneca. If you don't have a GP or you live in a community where you don't have access to one, you can contact one of the many health sites to get the jab. And of course, if you're under 60 years of age, and especially between 40 to 60 years of age, please come forward to get the Pfizer. Our health capacity is increasing. I want to thank the GP network. I know a lot of the GPs have been frustrated, but every time we've asked them to talk to us about how we can support them, we're talking to the federal government about increasing the number of GPs who have access to doses, making sure the GPs have access to Pfizer as well, because in the next few months we will need all hands on deck. And that's why I remember being criticised when we set up our mass vaccination clinic. People said to me, "Why are you doing it? You don't need it." Well, you have to plan for the future. You have to plan for the weeks and months ahead. And I'm getting frustrated that people aren't doing that at other levels. We need to plan ahead for the future. We need to make sure the vaccine is accessible to our all population, and we have those doses available. We need to make sure enough GPs are being signed up. I've been calling on this for weeks and weeks, if not months. Our GPs want to do more. They want more doses, and they also want more GPs to come online, and that is necessary. That's not something the New South Wales government can control.
In regards to assistance, how close are you to announcing a financial assistance package, and will it go on the Discover voucher?
Look, I'm hoping to be able to announce it either tomorrow or the day after in terms of financial assistance. But can I also stress in relation to the vouchers, where you can, we don't want people going up and picking up food. We prefer people to have a contactless system. So everything we announce to support businesses and obviously supporting people to support businesses will be around the COVID safety plans. We need to make sure there's less contact than...
Just returning to the vaccine there, you always said that it would be incentive orientated, that's how you'd get people to come forward. There are no incentives at the moment.
I don't know who said that, and I certainly haven't. There is, can I say this, until we have enough vaccines for everybody who wants a vaccine to take it, it's not fair to have incentives. A lot of people want the vaccine, they just don't have access to it yet. A lot of people have signed up with us and said they want the vaccine. It's not fair to put incentives in place when people are saying, hang on, I want the vaccine, I know what this means, and it's not fair to put incentives in place so early when the demand is still really high. When people talk about hesitancy, I shake my head, because we know from the people that have signed up registering their interest, we know that people are really keen to get vaccinated in New South Wales. The challenge we have, and it's not something the New South Wales government can control, is making sure we get those supplies. Now, we've been told in the next few weeks all states will be getting more supplies, which is a great news. We just say to everybody, be prepared to come forward and get vaccinated, because it is holding up to be extremely effective even against this very contagious strain of the virus. So I feel much safer having been vaccinated. I know many people will feel safer once they're vaccinated. But we need to make sure that those supplies are available, and we encourage everybody, don't be afraid to come forward and get the vaccine, so long as Dr. Chant said, so long as you don't have symptoms, you haven't been told to self-isolate for 14 days, please come forward and get the vaccine. As I said, the GP network, GPs are open during the lockdown period. GPs are available for them to administer the vaccine to you, as are all our New South Wales health sites. But we don't want any of those sites compromised if you have a symptom. If you have a symptom or are deemed to be a close contact, you shouldn't turn up, because we don't want that infection rate to increase.
Who specifically are you frustrated with, Premier? Who specifically are you frustrated
Sorry, I haven't asked you
The COVID gateway into Australia is uniquely through quarantine. can you guarantee that every single frontline worker who has anything to do with any overseas traveller, any driver, is vaccinated? And if anybody is refusing vaccination, why are they still working on the front line?
Well, can I say, we have said at the outset that every single person in and around the quarantine system has to have the vaccine. We stridently fixed the health orders on Monday, by midday Monday, to make it abundantly clear that if you are working in and around the quarantine system, you must be vaccinated. And in fact, I was the first, at the time, we called on the Commonwealth to let us do that, because obviously there was a strategy to prioritise aged care residents, which I completely understand. But given we continue to welcome so many people back through Sydney, I was also keen to make sure that extended. Now, what we can't assume is that 100% of the people are doing the right thing 100% of the time. Please know the New South Wales Government, the New South Wales Police Force, our health experts, all of us have collectively put in place the strict guidelines, but it also requires everybody in the system to do the right thing. Now, that is the challenge we have. The rules are there. We know what it takes to keep people safe. We know what it takes to make sure we do our best in containing the virus, but we also rely on people doing the right thing. And we rely on 100% of people doing the right thing 100% of the time. And we know that if one or two people choose for whatever reason not to do the right thing, or are complacent or forget, we know the consequences that can arise. But please let me be clear. Everybody in and around the system knows what they have to do. Everybody knows what is a safe way of conducting their business, but what the challenge we have is relying on people to do the right thing all of the time. But can I also take this opportunity, because I doubt many of us will be brave enough to do this, but we have tens of thousands of people who've signed up to work directly with people who have the virus. Now, I want to thank each and every worker. You've done that for 16 or 17 months. That takes guts and courage, and I don't know how many of us at home will put up our hand and say, I'm happy to work in a system dealing directly with people who have the virus. So we need to thank them for keeping us safe and thank them for doing their jobs so efficiently. And I really do want to express our deepest gratitude on behalf of all of our citizens in New South Wales.
There are thousands and thousands of people in isolation. They obviously have to go and get a test, 2 other tests before they get out to their close contacts. Are there any special arrangements for their testing?
I will ask Dr. Chant to speak about that, because there are some special arrangements in place, and I'll ask Dr. Chant to speak about that. I'll come back, don't worry, I'll come back, yeah.
Yes, and look, my apologies. When I gave the reassuring message to elderly people and frail that there's a prioritised line, we particularly want to make sure that we pull forward close contacts. We want to do that for 2 reasons, because if you've just been announced that you're at a close contact venue, we want you at the front of the queue. That helps us identify your exposures and get further public health action. We also will prioritise you throughout the period, because we appreciate the impost it's put on you to be in isolation, and thank you for coming out for testing. But it is critical, and given we have a number of families isolating as a group, it is important that everyone is tested. It does give us the assurance that we're not missing some transmission that may be sequential in those family and households, which will mean that you will be cleared if you attend for that testing.
Dr. Chant, just before the Premier comes back, can I just quickly ask, do you think that ATAGI would or should have another look at AstraZeneca, given the risk matrix has changed in Australia now?
Look, the ATAGI advice very much took into account a situation where there was an outbreak, and so ATAGI foresaw, and in terms of their risk assessment, risk-benefit ratio, very much the construct of an outbreak. And I think the lesson for this is, whilst we are aiming for community transmission and we've achieved it, that there are always going to be threats and risks, and we can never guarantee at any one point in time that you're never going to come in contact with someone with COVID, even when we get through this outbreak response. And hence I would call on everyone to not delay in coming out for vaccination. I'm very pleased that the doses of the vaccine are likely to increase in the coming months, and this is the time when we need to pull together and get vaccinated. As the Premier has indicated, until we have the all of the adult population over 16 at least offered the vaccination, we can't even have the conversation about the new world where we open up. And we also need to have that discussion about transmission and what that will look like once we take those steps. But we can't even have that conversation until we're vaccinated.
With other levels surrounding the vaccine rollout, I'm presuming that's the federal government. What are your frustrations with them?
Look, I would just like to make sure that we have measures in place to increase capacity for those extra doses. At the moment, we don't have enough GPs signed up, and that has to happen across the nation. That has to happen across the nation because we can see the number of doses we've been promised in the next weeks and months. But to make sure those jabs get into arms, I need to see more GPs across the nation be offered to sign up to the program, because we know New South Wales Health, we are managing the nation's largest quarantine system, the largest health system, bringing in thousands and thousands of Aussies, reuniting them back home with their loved ones every single week. And we also know what it takes to make sure we get our population vaccinated. And on top of all of those responsibilities, New South Wales Health managed to get over 100,000 people vaccinated. And remember, I begged the federal government to let us do that because the GP network alone, if we want to get people vaccinated in a timely way, we need more GPs signed up. We need our health system continuing to do what we can. But I'm loath to ask our health officials to obviously we can get more jabs in arms, but we also have all these other responsibilities about keeping the largest health system in Australia running, in managing our quarantine system, in managing all those other things we're doing. And of course, Minister Hazzard and I will be pleased to be talking about the progress we've made with pharmacists as well. But what we need to do is you need to do the work now to make sure when the supplies arrive that the work's been done, the capacity is there, and that's why I was happy to be criticised when we set up our max vaccination clinic, because I foresaw we'd get those extra supplies down the track. And similarly, all levels of government need to do the work now to make sure when the supply arrives that we get them into arms as soon as possible. And I will say that until I'm blue in the face, but that is the reality. We need greater capacity when those supplies arrive. And again, I read about stuff about vaccine hesitancy, but I know New South Wales, from the feedback we're getting, from the number of people that are registering, people want the vaccine. They understand how important it is. They want a safe vaccine. They want to get vaccinated. And we just need to make sure as soon as those supplies come from the Commonwealth, that whether it's the GP network, which the Commonwealth runs, whether it's the support we're providing on top of that and through our pharmacies and others, that we get the jabs into arms as soon as possible. Because until the vast majority is vaccinated, we can't have those conversations about COVID safe. It doesn't matter how good your systems are. Outbreaks are going to occur from time to time. Disruptions will continue until the vast majority is vaccinated. Now, previously we'd said in New South Wales that once 80% of our adult population is vaccinated, we can start having the conversation. But even then, as Dr. Chant has said, starting the conversation means just that. That's when we can start talking about incentives and other things, because until you have the vast majority of all of your population over 16 vaccinated, you run the risk of anybody not vaccinated getting the disease and having that threat about having to be on a ventilator in a hospital, which is what we're avoiding. So there is no doubt the vaccination is our key to freedom into the future. And the New South Wales government has been vigilant every step of the way in planning for those extra doses. But one thing I can't control, the New South Wales government can't control, is the supply and the doses. But we do know, and we do have positive messages and reinforcements from the Commonwealth government that those supplies are increasing. I'm grateful for that. I want to thank the Commonwealth for telling us and for providing us those extra vaccines in the next weeks and months, because I know that as far as New South Wales residents are concerned, they are keen to get vaccinated, keen to try and get to a stage where we can have a normal existence moving forward, and I'm looking forward to that as well.
Just on hotel quarantine.
Airport workers
Why are we still taking international arrivals when Sydney is exempt?
Well, we are doing that because it's the right thing to do. It's the compassionate thing to do. and I appreciate the risk that comes with that, which is why I've argued for a long time that given New South Wales is doing the heavy lifting there, that consideration should be given to those vaccines coming our way. Obviously, if we said to Australians, you can't come back home, and that's really a decision for the federal government. But I support their decision in continuing to allow Australians to come back home. I just wish every state would do its fair share. We've had other states, because of their situation, not be able to do their fair share. We will continue to do that. But I think it demonstrates the burden that New South Wales has been carrying, and the fact that we anticipate and expect those decisions are made at a Commonwealth level. We'll continue to do what we've been asked to do because it's the right thing to do, and certainly many families from other states have written to the New South Wales government grateful that we've been letting their loved ones back in, because imagine being an Aussie stranded somewhere overseas and not being able to come home. Now, that is a basic human right that all of us have as Aussies, to be able to come back home. And that's why the New South Wales government has supported the national strategy. But I just ask other state leaders to also consider what they can do, as difficult as it is. It's just getting the right balance.
Anastasia Palaszczuk said this morning, she flagged this morning already, Brisbane's got a much smaller outbreak than what we do at the moment in Sydney, but she's already flagged that she would like to take to National Cabinet a reduction in those numbers going through hotel quarantine there. We're in lockdown with a much bigger outbreak here. Would you support a reduction?
Well, the risk occurs whether you're bringing back 100 Aussies a week or 3,000 Aussies a week, the risk is still there. It doesn't really relate so much. I mean, obviously, the more you're bringing home, the risk intensifies. But we've seen states with bringing back home very small numbers of Aussies still having outbreaks. So we're seeing some states still experience outbreaks with a very small number of Aussies coming back home in that week. So we know the risk is always there. The risk of an outbreak, so long as you're welcoming Aussies back home, the risk is always there. As I said, it only takes one person to have a lapse in concentration for the virus to get out. And that's why I'm so deeply grateful that thousands of our men and women on the front line have not had that lapse. They've actually been on the job 100%. So the risk is always there no matter how many people you're bringing home. Obviously, the larger numbers you have, the greater the risk. But our system is robust. We have a rhythm, and we're supporting the nation. And let's remember, every time a plane lands in Sydney Airport, it's bringing valuable freight. It's making sure post-COVID that airlines aren't giving up on Australia, because we have to think about life post-COVID. We have to think about life once our population is vaccinated. We're starting to see countries talk to each other about opening travel. We don't want Australians left behind in the future because we've taken the wrong decisions today. So they're all the things that we have to factor, but all the things the federal government has to factor in terms of international returns, as that's their policy area. What we're doing as a state is our fair share. And I just asked other states to consider it. But it is a scary time. Let's not pretend that when you have a contagious variants, and obviously these contagious variants are going to be the norm in the future, it is scary. It's scary having to juggle all the balls. But what we need to do is make sure that we have the right balance of policies and settings. And I'm deeply grateful to our citizens for understanding that. And I appreciate frustrations will increase as the lockdown progresses. But it's a necessary decision we had to take.
Just on the airlines, you're requiring all airport workers.
Can you confirm if July 9th is also the current end date for regional restrictions? And if there's no regional cases or regional exposure sites, would you consider lifting those earlier?
Just in relation to regional New South Wales, can I thank everybody for your patience and for adhering to the restrictions. Even though we haven't had a case, the risk is there. For example, as you saw the case of a miner in the Northern Territory having the virus, that miner was exposed to, I understand, 900 other people who are spread across regions across Australia. So just because there isn't a case there now doesn't mean the threat's not there. And we have had movements between states and between individuals prior to those restrictions coming into New South Wales or other states. So even though you might not have a case in your community, the restrictions are there to make that continue, because we know that there have been some exposures to regions across Australia, and there has been movement across regions, and we also know that we are keeping freight and logistics going, so there's always that threat of movement, especially in regional communities, because regional communities provide us with many of the goods and services we need to survive, and I'm deeply grateful for that. So the risk is there even though the cases aren't there, and I think it's only appropriate to have those restrictions in place. But obviously we follow the health advice, but if everybody does the right thing and what we anticipate happens, there's no reason why it should last more than 2 weeks. However, that is based on the health advice, and if Dr. Chant and her experts say to us it's enough, that's great. But if she says to us, I want a bit more time, that's something we have to be open-minded about as well. But the best advice we get is the best advice we convey to the community, and that's 2 weeks.
Commissioner Fuller, just in relation to enforcement.
Could we ask you to clarify some of the details surrounding, in particular, the sunbathers? Did they drive illegally down to the south coast, and how would you describe that behaviour, really?
Look, I think, as the health minister said yesterday, it's difficult to legislate against idiots, but you know, clearly putting people at risk by leaving home without a proper reason, and I think they're not only on top of that, but then getting lost in the national park and diverting important resources away from the health operation. I think they should be embarrassed. But again, they both received $1,000 fines. So.
Just on airline, can I just ask you a question about airlines, please?
What did you make of the scenes in the eastern suburbs yesterday? So many people on Bondi Beach. There are a lot of people around, people just sitting around doing, you know, not really complying with health laws.
Yeah, and part of the reason we're being here today is to up the messaging. I think during 2020 we're extremely fair in relation to the way we enforced it. We are ramping up clearly. We've nearly tripled the amount of fines that we've given from the day before, and obviously we'll continue to treble down on that. So we want people to listen to the health orders. When they follow the Premier's advice, obviously we've always done well.
Specifically on the health orders, Commissioner Fuller, one of the reasonable excuses for someone to leave the house is outdoor recreation.
Exercise.
It's exercise or outdoor recreation. What's your understanding of the phrase outdoor recreation, and if outdoor recreation is allowed, should it be changed to just exercise?
Look, you know, the health orders have evolved over the course of the last 15 months, and if we think there's some confusion, from the police in the field, we are still issuing cautions to people if we think it's a line ball call, but clearly we don't want people outside unless it's necessary, and if you need to exercise, exercise close to home.
Just one question on airport workers, please.
That's fine. Sorry, what was the basis upon which...
question for you. Did you receive my notice of cease and desist?
It's not your time. Sorry,
I understand this. Sorry. No. You were served.
Don't come near me.
Served with a notice to cease and desist. I captured this there.